National Center for Public Policy Research. I want to thank the FDA for holding this meeting. The National Center for Public Policy Research, in terms of disclosure, receives approximately 99% of our funding from individuals around the country, including many smokers who are trying to quit. We also receive funding from pharmaceutical companies who would stand to be hurt by harm reduction, and cigarette companies that would stand to be hurt by harm reduction, as well as some smokeless tobacco sources. I praise the FDA for holding this meeting because this is a special time that we're actually having a conversation that I think and I hope is about the notion of tobacco harm reduction. I wrote a piece for the Guardian newspaper just last week praising the FDA compared to the EU, where they're not even engaging in this process. And I have some concerns about some of the things that were said this morning and the way that some of the questions are being phrased, which I'll address in my comments. But the very fact that this meeting is being held, as Scott Phelan said this morning, is a huge step forward. And while I may have some criticism and others may have some criticisms, those of us that support harm reduction, I think are appreciative of the fact that the FDA is holding science-based, transparent meetings in an effort to actually have a policy that will go forward to improve public health. And comparing it globally, I think we're moving in the right direction. And those are the nice things I have to say. I appreciate the opportunity to speak towards the end, especially after some of the earlier panelists, especially with what Scott Phelan said, which is just so important in terms of having this open dialogue. It's rare to hear applause. We heard him after Bill Godshall's talk. And I'd like to go after Bill because not only do I endorse what he said, but I think it's a good opportunity for the backdrop. Dr. Shields said earlier that this framework is not public policy, and I would respectfully disagree, or at least question whether or not this framework is public policy or not. Because the questions that are asked, the types of questions that are asked, will influence public policy, appropriately so. So let's not act like this is not public policy. This is a part of the public policy process. The science appropriately is playing a role in that. And therefore, the types of questions that we ask here and the answers that we get are appropriately part of the public policy approach. I'm not going to use my full 7 minutes, okay? I want to make a very clear point here. The questions that we ask are public policy. And the questions are really one of two things. Is our goal here to, as we heard this morning, to reduce and eliminate tobacco use, which I think some people are calling for, or is it to reduce and eliminate the health effects of tobacco? And that is the critical question. Are we here to reduce tobacco use, or are we here to reduce the health effects of tobacco use? Very different questions, very different answers in terms of public policy. How many smokers will continue to smoke as the FDA explores and tackles these questions? Smokers are dying every day. New smokers are coming on board. Is it really so complex? Some of the earlier presentations made it look complex, and it is complex. Scientists and policymakers are good at making things complex, and I think it will get more complex. But at the end of the day, as Bill Godshall pointed out, the fact that smokeless tobacco is less harmful than cigarettes, smokeless tobacco is less harmful than cigarettes, is a very simple concept. And we can make it complex, but people will continue to die as we do that. And there are those in public policy, advocates, anti-tobacco advocates, who seek to withhold scientific information from the public. And in doing so, we always have to beware of the unintended consequences of public policy, that people will continue to die so long as we don't offer alternatives. And we can make this as complex as we want, but the bottom line is two questions. Are we here to reduce tobacco use, or are we here to reduce the health effects of tobacco use? And that's, I think, the question before you.